Hi, my name is Brenda Landeros, and today I'm going to talk about aging in society to the American Gerontological Efficacy Department of the U.S. government. What is GSA? GSA is the largest and oldest multidisciplinary organization devoted to the study of aging. Yes. And then what is the goal? The goal of the GSA is to advance aging related research, instructions, and practice. They stress how crucial it is to comprehend aging from a variety of angles, and such as biological, psychological, and social and medical. Through several programs and partnerships, the GSA also seeks to counteract ageism and encourage healthy aging. When was it established? So GSA was established in 1945 with the goal of improving older adults' quality of life by advancing aging research, education, and practice. Western culture on aging, individualism, and youthfulness. Emphasis on youth. Aging is frequently perceived through a prism of individualism and youth in many Western societies, including the U.S. and most of Europe. According to Howie, TR 2018, the preservation of youth and physical attractiveness is highly valued in the culture. Because aging is sometimes viewed as a decline, the market for anti-aging products and cosmetic procedures is flourishing. And that's what emphasis on youth, that was the definition of that. Independence. Independence is in retirement communities or nursing homes. Older adults are encouraged to keep their independence and frequently live apart from their families. Ageism is a tendency that can lead to older adults being marginalized or undervalued in society and the workplace. Non-Western culture on aging. We're going to talk about Eastern culture. According to Howie, TR 2018, Eastern culture is, in contrast, respect for elders and collectivism are highly valued in many Eastern cultures, including those in Asia. Respect and reverence. Because of their experience and wisdom, elders are frequently admired and respected. They have a big say in family choices and neighborhood events. Multi-generational living. It is typically for several generations to cohabitate, offering senior family members both practical and emotional support. Culture practices. Elders are frequently featured in significant religious and cultural rituals, underscoring their high and social standings. Another non-Western culture on aging was Latin American culture, which is the family relationship and intergenerational support are also valued in Latin American societies. Family-centric. Older adults are cared for and continue to play an important role in family life because family frequently live close to one another or in multi-generational households. Positive aging. Many older adults have a more positive outlook on aging, believing that life becomes more significant as they get older. Now let's talk about historically versus 21st century on elders. Right now I'm going to speak on historical treatments of elders. So family-centered care. According to the Evolution of Elderly Care, Past, Present, and Future Perspectives, ND, family-centered care is elder care was traditionally primarily the responsibility of the family. Elders were valued and cared for as essential family members in multi-generational households where they frequently resided with their adult children. Reverence and wisdom. Elders were respected because of their knowledge and expertise. They were regarded as stewards of family and cultural customs and played an important role in decision making. Limited medical knowledge. There was little medical knowledge of age-related illnesses. Families turned to community healers and conventional treatments, which were always successful. Community support. In many cultures, elders were supported by the community, particularly when families were unable to care for because of serious health problems. And now, historically versus 21st century, we're going to talk about 21st century treatments for elders. Care and institution. Some caregiving duties have been transferred from families to professional institutions. Due to the growth of nursing homes, assisted living facilities, and retirement communities, these facilities provided specialized care that is suited to senior citizens' needs. Technological advancements. Elder care has been transformed by modern technology, health monitoring systems, smart home appliances, and telemedicine improve medical care and increase older adults' independence. Holistic approaches. The significance of social, mental, and emotional well-being in elder care is becoming increasingly acknowledged. These days, social interactions, therapies, and activities are all essential components of care plans. Policy and advocacy. Many older adults' quality of life has improved as a result of increased support for elders' rights and policies that benefit aging population. Addressing the special needs of the elderly is a greater priority for governments and organizations. And this is all according to Now C 2023 September 6th. And this is in my reference. Now, trends that impact the mental and physical struggles of aging. Increased longevity and chronic conditions. We're going to talk about description and impact, and also social isolation and loneliness, and also description and impact. So, increased longevity and chronic condition. The description is longer life expectancies are a result of improvements in healthcare, but this also means that more people are dealing with chronic illnesses like diabetes, arthritis, and heart disease. Physical restrictions and high reliance on caregivers may result from these conditions. The impact to this is for older adults, managing several chronic conditions can be mentally and physically taxing. Infrequently necessities, continuous medical attention, medication administration, and lifestyle modification, all of which can increase anxiety, depression, and stress. So now we're going to talk about social isolation and loneliness. And this one's according to Howie, TR 2018. People's social network may shrink. We're talking about description, sorry. People's social network may shrink as they get older as a result of mobility problems, peer death, or retirement. Increased feelings of social isolation and loneliness may result from this. Number 2 is the impact. So an important risk factor for mental health conditions like anxiety and depression and social isolation. Additionally, it can have a detrimental impact on physical health, resulting in elements like immune system weakness and high blood pressure. To lessen these effects, social interactions and persevering relationship with family and friends are essential. Trends that impact the mental health. There is one more trend that I have, which is technological advancements in healthcare. The description to this is according to Abramson, A&D, and the reference is on there. Description is that the use of technology in elder care is becoming more and more significant. Smart home appliances, wearable health monitors, and telemedicine are some of the innovations that are assisting older adults in better managing their health. And then the impact to that is that these technologies have drawbacks. Even though they can increase independence and enhance health outcomes due to the cognitive decline or unfamiliarity, older adults may find it difficult to adopt new technologies. Providing sufficient training and making sure the technology is easy to use can help lessen these difficulties. Examples of strategies for older adults to overcome aging-related mental and physical challenges. Number 1, I put staying physically active. The example is regular exercise such as yoga, swimming, or walking can support the maintenance or physical mobility and health. And this improves mood and vitality while lowering the risk of chronic illnesses. The impact on family life is maintaining an active lifestyle enables senior citizens to engage more fully in family activities like playing with their grandchildren or going on family vacations, strengthening family ties. So, the conclusion to all this, in summary, I just want to say raising awareness about the essential roles of geriatric nurse practitioner, which is GNPs, and gerontologists involves educational campaigns, community engagement, media collaboration, advocacy, and leveraging professional associations. Understanding cultural perspectives on aging reveals significant differences between Western and non-Western societies, with varying degrees of reverence and care for elders. Historically, elders were primarily cared for by their families and held in high esteem for their wisdom. In the 21st century, while institutional care and technological advancements have improved elder care, challenges such as social isolation and chronic conditions persist. Trends like increased longevity, social isolation, and technological advancements significantly impact the mental and physical struggles of aging. To overcome these struggles, older adults can stay physically active, maintain social connections, adapt healthy lifestyles, engage in lifelong learning, and seek professional help. These strategies not only improve their well-being but also enhance family life by fostering stronger bonds and reducing caregiving burdens. By understanding and addressing these aspects, we can create a more supportive and respectful environment for our aging population, ensuring they lead fulfilling and dignified lives. Thank you so much.